This video lecture was made by the Center for Future Dentistry under the SNUSD Knowledge Share Initiative with the support of the Korean Ministry of Trade, Industry, and Energy. Welcome back, and thanks for tuning in. In this lecture, I'm going to summarize the muscles of upper limb. Muscles of shoulder. There are 6 muscles in the shoulder, although there are some extrinsic muscles from front chest wall and the back, which will be discussed in other lectures. The first group of muscles I'm going to talk about in this shoulder region is called as rotator cuff. The rotator cuff is an anatomical term given to the groups of 4 muscles and their tendons that act to stabilize the shoulder. These muscles are the supraspinatus, infraspinatus, teres minor, and subscapularis. These hold the head of humerus in the glenoid cavity during movement. The cuff adheres to the glenohumeral capsule and attached to the head of the humerus. Together, these keep the humeral head in the glenoid cavity, preventing upward migration of the humeral head caused by the pull of the deltoid muscle at the beginning of arm elevation. The infraspinatus and the teres minor, along with the anterior fibers of the deltoid muscle, are responsible for the external rotation of the arm. The 4 tendons of these muscles converge to form the rotator cuff tendon. These tendons, along with the articular capsule, the coracohumeral ligament, and the glenohumeral ligament complex, blend into a confluent sheet before insertion into humeral tuberosities. The infraspinatus and teres minor fuse near their musculotendinous junctions, while the supraspinatus and subscapularis tendon join as a sheath that surrounds the biceps tendon at the entrance of the bicipital groove. Supraspinatus muscle. Origin. Supraspinous fossa of the scapula. Insertion. Greater tubercle of the humerus. Infraspinatus muscle. Origin. Infraspinous fossa of the scapula. Insertion. Greater tubercle of the humerus. Subscapularis muscle. Origin. Subscapular fossa of the scapula. Insertion. Lesser tubercle of the humerus. Teres minor muscle. Origin. Lateral border of the scapula. Insertion. Inferior facet of the greater tubercle of the humerus. These 4 muscles are the rotator cuff muscles. In addition to the 4 muscles of the rotator cuff discussed just before, the deltoid muscle and the teres major muscles arise and exist in the shoulder region itself. The deltoid muscle covers the shoulder. Teres major muscle. Origin. Posterior aspect of the inferior angle of the scapula. Insertion. Medial lip of the intertubercular sulcus of the humerus. Now we are going to move on to the arm muscles. In the arm, there are fascial compartments which refer to the specific anatomical term of the compartment within the upper segments of the upper limb, that is to say, the arm of the body. As you already learned from MK Anatomy, that the upper limb is divided into 2 segments, the arm and the forearm. Each of these segments is further divided into 2 compartments which are formed by deep fascia, top connective tissue septa walls. Each compartment encloses specific muscles and nerves. The compartment of the arm are the anterior compartment of the arm and the posterior compartment of the arm, divided by the lateral and the medial intermuscular septa. The anterior compartment contains 3 muscles, the biceps brachii, the brachialis, and the coracobrachialis. These muscles are all innervated by the musculocutaneous nerve, which arises from the 5th and 6th and 7th cervical spinal nerves. The blood supply is from the brachial artery. The anterior compartment of the arm is also known as the flexor compartment of the arm, as its main action is that of flexion. Coracobrachialis muscle. Origin. Coracoid process of the scapula. Insertion. Anteromedial surface of the humerus, distal to crest of the lesser tubercle. Biceps brachii muscle. This muscle has two heads. The short head has its origin at the apex of the coracoid process of the scapula. On the other hand, the long head has its origin at supraglenoid tubercle of the scapula. Both heads have the same insertion site at radial tuberosity of the radius. Brachialis muscle. Origin. Distal half of the anterior surface of the humerus. Insertion. Coronoid process and tuberosity of the ulna. The muscles of the posterior compartment are the triceps brachii and the anconeus muscle, and these are innervated by the radial nerve. Their blood supply is from the profunda brachii. The posterior compartment of the arm is also known as the extensor compartment, as its main action is extension. Triceps brachii. This muscle has three heads. The long head has its origin at infraglenoid tubercle of the scapula. The medial head has its origin at posterior surface of the humerus, inferior to the radial groove. The lateral head has its origin at posterior surface of the humerus, superior to the radial groove. All three heads have its insertion at olecranon of the ulna. Anconeus muscle. Origin. Lateral epicondyle of the humerus. Insertion. Lateral surface of the olecranon of the ulna. The anconeus is a small muscle that stabilizes the elbow joint during movement. Some embryologists consider it as the fourth head of the triceps brachia, as the upper and lower limb have similar embryological origin, and the lower limb contains the quadriceps femoris muscles, which has four heads, and it is the lower limb equivalent of the triceps. Now we are going to talking about the forearm muscles. The forearm is the region of the upper limb between the elbow and wrist. The term forearm is used in anatomy to distinguish it from the arm, a word which is most often used to describe the entire appendage of the upper limb, but which in anatomy technically means only the region of the upper arm, whereas the lower arm is called the forearm. It is homologous to the region of the leg that lies between the knee and the ankle joint, which has the name of the crus, or leg. The forearm contains many muscles, including the flexor and extensors of the digit of flexor of the elbow, and pronator and supinator that turn the hand of the face down or upwards, respectively. In cross-section, the forearm can be divided into two fascial compartments. The posterior compartment contains the extensor of the hand, which are supplied by the radial nerve. The anterior compartment contains the flexor and is mainly supplied by the medial nerve. The flexor muscles are the more massive than the extensor muscles because they work against gravity and act as anti-gravity muscles. The ulnar nerve also runs the length of the forearm. The forearm also has compartments like the arm. The compartments of the forearm are the anterior compartment of the forearm and posterior compartment of the forearm. First, we are talking about the anterior forearm muscles. The muscles are largely involved in the flexion and pronation. The superficial muscles have their origin on the common flexor tendon. The ulnar nerve and the artery are also contained within this compartment. The flexor digitorum superficialis lies in between the other four muscles of the superficial group and the three muscles of the deep group. This is why it is also classified as the intermediate group. Pronator teres muscle. Origin. Humeral head. Medial supracondylar ridge of the humerus. Ulnar head. Coronoid process of the ulna. Insertion. Lateral surface of the radius. Palmaris longus muscle. Origin. Medial apocondyle of the humerus. Insertion. Flexor retinaculum. Palmar aponeurosis. Flexor carpi radialis muscle. Origin. Medial apocondyle of the humerus. Insertion. Base of the metacarpal bones from second to third. Flexor carpi ulnaris muscle. Origin. Medial apocondyle of the humerus. Olecranon and posterior border of the ulna. Insertion. pisiform bone, hamate bone, base of the fifth metacarpal bone. Flexor digitorum superficialis muscle. This muscle has two heads. Origin. The first, humeral ulnar head, medial apocondyle of the humerus, and coronoid process of the ulna. The second, the radial head, has its origin at proximal half of the anterior border of the radius. Insertion. Size of the middle phalanges of the second to fifth digits. These five muscles, that is to say, pronator teres, palmaris longus, flexor carpi radialis, flexor carpi ulnaris, flexor digitorum superficialis is the superficial anterior forearm muscles. Next, we are talking about the deep anterior forearm muscles. Pronator quadratus muscle. Origin, distal anterior surface of the ulna. Insertion, distal anterior surface of the radius. Flexor digitorum profundus muscle. Origin, proximal half of the anterior surface of the ulna and interosseous membrane. Insertion, palmar surfaces of the distal phalanges of the second to fifth digits. Flexor pollicis longus muscle. Origin, anterior surface of the radius and interosseous membrane. Insertion, palmar surface of the distal phalanx of the thumb. The next is the posterior forearm muscles. They are classified as superficial and deep group, like anterior forearm muscles. The posterior compartment of forearm, or extensor compartment, contains 11 muscles, which are chiefly responsible for extension of the wrist and digits and supination of the forearm. It is separated from the anterior compartment by the interosseous membrane between the radius and ulna. Brachioradialis muscle. Origin, lateral supracondylar ridge of the humerus. Insertion, styloid process of the radius. Extensor carpi radialis longus muscle. Origin, lateral supracondylar ridge of the humerus. Insertion, posterior aspect of the base of the second metacarpal bone. Extensor carpi radialis brevis muscle. Origin, the anterior of the lateral apicondyle of the humerus. Insertion, posterior base of the third metacarpal bone. These three muscles, that is to say, the brachioradialis, extensor carpi radialis longus, and brevis, are called a mobile wad. The next one is the extensor digitorum muscle. Origin, lateral apicondyle of the humerus. Insertion, extensor expansion of second to fifth digit. Extensor digiti minimi muscle. Origin, lateral apicondyle of the humerus. Insertion, extensor expansion of fifth digit. Extensor carpi ulnaris muscle. Origin, lateral apicondyle of the humerus and posterior border of the ulna. Insertion, base of the fifth metacarpal bone. Until here, the six muscles, that is to say the mobile wad three muscles and extensor digitorum and extensor digiti minimi and extensor carpi ulnaris, are the superficial posterior forearm muscles. From here, the supinator muscle, we are talking about the deep posterior forearm muscles, supinator muscles. Origin, lateral apicondyle of humerus, radial collateral ligament, and supinator crest of ulna. However, unfortunately, it doesn't look like such description in this specimen. Insertion, lateral, posterior, and anterior surface of the proximal third of radius. Abductor pollicis longus muscle. Origin, posterior surface of the proximal half of the radius, the ulna and interosseous membrane. Insertion, base of the first metacarpal bone. Extensor pollicis brevis muscle. Origin, posterior surface of the distal third of the radius and interosseous membrane. Insertion, posterior aspect of the proximal phalanx of thumb. Extensor pollicis longus muscle. Origin, posterior surface of middle third of the ulna and interosseous membrane. Insertion, posterior aspect of the base of distal phalanx of thumb. Extensor indicis muscle. Origin, posterior surface of distal third of the ulna and the interosseous membrane. Insertion, extensor expansion of index finger. Now let's continue to the final part of this lecture, the muscles of hand. The muscles of hand are the skeletal muscles responsible for the movement of the hand and fingers. The muscles of the hand can be subdivided into two groups, the extrinsic and intrinsic muscle group. The extrinsic muscle groups are the long flexors and extensors. They are called extrinsic because the muscle belly is located on the forearm. This means that we have already talked about these muscles in the former section. On the other hand, the intrinsic groups are the smaller muscles located within the hand itself. The muscles of the hand are innervated by the radial, median, and ulnar nerves from the brachial plexus. The intrinsic muscle group are the thenar, thumb, and hypothenar, little finger muscles. The interossei muscles, 4 dorsally and 3 volarly, originating between the metacarpal bones, and the lumbrical muscles arising from the deep flexor, and which are special because they have no bony origin to insert on the dorsal extensor hut mechanism. Palmaris brevis, which is superficial muscles, and adductor pollicis is also intrinsic muscles. Let's begin with the lateral volar muscles. The first one is the opponens pollicis muscle. Origin, tubercle of trapezium bone and flexor retinaculum. Insertion, radial border of the first metacarpal bone. Flexor pollicis brevis muscle. It has two heads. The superficial head has its origin at flexor retinaculum and tubercle of the trapezium bone. The deep head has its origin at trapezoid and capitate bones. Insertion. Lateral aspect of the first proximal phalanx base. Abductor pollicis brevis muscle. Origin. Tubercle subscaphoid and trapezium bones and flexor retinaculum. Insertion. Lateral aspect of base of the first proximal phalanx. These three muscles, that is to say, the opponens pollicis and flexor pollicis brevis and abductor pollicis brevis, are called as a thenar muscle among lateral volar muscles. Adductor pollicis muscle. It has two origins. The transverse head has its origin at anterior body of the third metacarpals. The oblique head has its origin at bases of the second and third metacarpals and the adjacent trapezoid and capitate bones. Insertion. Medial side of the base of the proximal phalanx of the thumb and the ulnar sesamoid. Next is the medial volar muscles. Opponens digiti minimi muscle. Origin. Hook of hamate bones and flexor retinaculum. Insertion. Ulnar aspect of the fifth metacarpal bones. Flexor digiti minimi brevis muscle. Origin. Hook of hamate bones and flexor retinaculum. Insertion. Base of the proximal phalanx of the fifth digit. Abductor digiti minimi muscle. Origin. Pisiform bone and tendon of flexor carpi ulnaris muscle. Insertion. Ulnar side of base of the proximal phalanx of the fifth digit and extensor expansion of the fifth digit. These three muscles are the hypothenar muscles. Palmaris brevis muscle. Origin. Palmo-aponeurosis and flexor retinaculum. Insertion. Dermis of skin of the hypothenar region. So finally, we are talking about the intermediate muscles. Lumbrical muscle. Origin. Tendons of flexor digitorum profundus muscle. Insertion. Tendons of flexor digitorum profundus muscle. Dorsal interosseous muscle. Origin. Adjacent side of the metacarpal bones. Insertion. First and second ones has its insertion at radial bases of the proximal phalanges and extensor expansor of second and third digits. Third and fourth has its insertion at ulnar bases of proximal phalanges and extensor expansions of the third and fourth digits. Palmar interosseous muscle. Origin. Ulnar side of the second metacarpal bones and radial side of the fourth and fifth metacarpal bones. Insertion. The first one has its insertion ulnar base of the proximal phalanx and extensor expansion of second digit. Second and third has its insertion at the radial base of the proximal phalanges and extensor expansion of the fourth and fifth digits. This is the end of this video clip. Thanks for watching.